Dr. Bilski, we've talked about dental implants before and answering various questions here, but what are the steps in doing a dental implant, the whole procedure?
Yeah, I always start with the education first, so let's just call that step one.
Okay.
All right. And we already discussed this. The questions are, is it going to hurt? How long does it take? What's it going to cost? Number one really is the cost. So the cost we bring up front first. And then we also have books that we can show them, like this is the procedure. This is what it'll look like when it's done. What is it that you would like to do? So a single implant in a healed site, meaning you've had a missing tooth. Mm-hmm. You have what's called enough bone volume, meaning is there enough space for the implant? So that would be the second appointment to put it in. You get the stitch out if you need it. That's the third appointment. And then we wait some time. And then about 2 or 3 appointments after that. So you could be anywhere from 5 to 6 appointments.
Okay.
All right. Say we were talking earlier about terminal smile.
Yeah.
It's just, we can't revive this. There's no CPR in dental to take care of that. So that would be what's called all on X. What that means is how many implants. It's usually between 4 or 6 implants. So say you're losing all your upper teeth, we put 4 implants in, and then we have a temporary bridge that is actually attached to the implants via these little tiny micro screws. Okay. So the first appointment, evaluation. Second appointment, get the teeth removed, the implants in place. If the implants are stable and you're healthy, we put the teeth on that same day. Then you come back a few months later for a scan. And then the fourth appointment, we put the teeth in. So it doesn't make sense we're doing more, but it's 4 appointments.
That is, I was just going to mention the same thing.
Versus 1.
It seems like a flip-flop of logic.
Because there's so many things that we have to contend with when we're working with, and I look at it this way, like say you wanted to put an addition on your house, but you have to, it's pretty close to that tree.
Yeah.
It's pretty close to that gas line. Where can we put this? And close to your neighbor. Your neighbor's house kind of leans in. Did you know your neighbor's tree is hanging over? A lot of contending things that we have to contend with. And then, so it may take a little effort to work that through. It's wearing temporaries. You don't like the shape of it. We got to change shape. When we take everything out, now it's like we just demoed the entire house.
Yeah.
We flattened it. We dug the basement. We put the foundation in the implants. And then now it's just, where do we want to put this?
Nice. Okay.
No, I'd like it over here a little bit. Okay, that's fine. How's the color? That's good. How's it?
Okay.
Good length? Yep, I like it. So it's streamlined, and because it's all done digitally, we can show you what your teeth are going to look like prior to.
So I can see my picture. And
like we'd actually take a picture, and with the new technologies and the way they can do it, you can see yourself with your new smile.
Oh, that's pretty neat.
Yeah.
I know you guys are on the cutting edge of everything there at
we try
Bilski Dental. Yeah, there's always new toys, and we got another video where he talks about the latest toy he brought back from overseas, in fact. So
from Italy.
From Italy, and it's at the website, so maybe check out